Labia Majoras. Everything you should know before getting them done, or what you should know before getting them done, coming up next on Consultations by a Piercer, episode number 52. For those that are new to the channel, welcome to the Body Piercing and Tattooing channel. Hope you're enjoying the videos. Hope you find them helpful and useful, but you may not know who I am. My name is DaVo. I'm a professional body piercer and have been since 1994. I own and operate the Axiom Body Piercing Studio, located right here in Des Moines, Iowa, inside Skin Kitchen Tattoo. Well, before we get into this, let's start off with a little bit of disclaimer. I'm going to be talking about a genital piercing, a piercing that's in the vulva of the body, the human body. And if you do not want to learn about genital piercings, or you are easily offended, or you're not of an age that information may not be appropriate or proper where you live in the world, please find another video. We have plenty of videos that have absolutely nothing to do with genital piercings or any of this on our channel, and I'm sure you'll find a lot of good information there. If you're one of those people that's looking for something titillating and exciting or whatever, you're going to be highly disappointed. This video is designed for those thinking about getting this piercing, or maybe their partners, or, just those that want to learn a little bit more about what this piercing involves, possibly to see if it's for them or for their partner. With that out of the way, let's talk about where this piercing is located at. Basically, the labia majoras, or outer labias, it is pierced usually with a ring to the outside, and usually done in sets that are offset slightly so they don't kind of bang into each other, usually high on the vulva. Healing time, average healing time on this is going to be anywhere, usually they heal out in about 6 to 8 weeks, but I suggest treating them like a healing piercing for 3 months, during which time you're going to want to clean them twice daily using a sterile saline spray. My personal favorite, and what we sell here in the studio, is Neomed's Piercing Aftercare. It comes out in a fine mist. You can find it at most good piercing studios. If for one reason or another you can't find it in your part of the world, or what have you, there are alternatives. Main things you want to look for is that it is in a can. It is pressurized. It says sterile on the front of it. And when you flip it over and look on the back, the only things you see in there are water and sodium chloride. No preservatives, no additives, nothing extra. Now, if the main difference is going to be the difference between the two, you may find, is the type of nozzle they have. With the Piercing Aftercare, it comes out in a fine mist, which makes it easy just to spray it directly onto the piercing. If it comes out kind of like a squirt gun or pretty powerful, you may want to do compresses. The best way to do that is take a sterile piece of gauze sponge, or if you need to, a clean folded up paper towel, saturate it, and then lay it against the piercing for about 5 to 10 minutes. If you're just using the spray type, just spray it, let it stay on there for about 5 minutes. There's no reason to wipe it off or dry it off or rinse it. It'll pretty much air dry and is perfectly fine. You want to do that twice a day. The other thing I'm going to suggest doing is the end of your shower, stick your pelvis out and let the water flow over the area for about 30 seconds. Not only does this feel good, but it also helps to do what we're trying to do with the saline rinses. What we're doing with these two things, the saline and the rinsing of the showers, we're trying to remove the discharge that hardens and collects on the jewelry. The reason we want it off there is when it moves or jingles around or what have you, it's uncomfortable. It'll feel like it's pulling a scab. The other thing is it can agitate the piercing, which can lead to other problems. So I always tell people, if you get to a point where it seems like there's an obsessive amount of it, or these two methods is just not working, instead of running the medicine cabinet and pulling out everything tipped in cotton or with a sharp point and digging around in there, which is going to probably lead to some problems, go see your piercer, have them take a look at it, and have them clean it for you. There might be something else going on that needs to be addressed, and it's usually best just to kind of have a checkup and let them do it. Now let's talk about things you don't want to do. Cross-contamination prevention. Most of this is common sense stuff. Wash your hands before you handle the jewelry. No oral contact or exchange of bodily fluids on or around the piercing for a minimum of 6 months. Now, that doesn't mean you can't have sex for 6 months. That just means that you need to use some type of latex barrier. And I will get further into that when we talk about that in the section that we talk about sex. Also, keep your environment clean. Clothing, bedding, towels, anything that may come in contact with the piercing does need to be cleaned on a regular basis. Do not swim. I know you're going to have multiple different, after a week I swim and blah, 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 and I don't, and sewage and polluted water and blah, blah, blah. Here's the deal. You have an open wound on your body when you have a healing piercing. Any body of water that you can submerge yourself completely in and move around in is going to be filled to the brim with microorganisms. The healthier the environment, the more the case that's going to be. None of these are really terrifically healthy when they get into an open wound. It can lead to an infection. So it's best to stay out of the water until the piercing is healed. This one always makes people give me a weird look. Keep pets away from it. Mainly what I'm concerned about is your pet's contact with clothing and bedding and etc. For example, don't let them sleep in the bed. Don't let them sleep in the under the covers. In fact, limit their access to your bedding 100% and change it on a regular basis. Now let's talk about clothing, trauma, and abuse. Avoid clothing that's constrictive or abrasive. If it hurts to wear something, you probably shouldn't be wearing it. Listen to your body. Culprits with this would be really, really tight jeans that are very stiff. Having that contact and movement isn't going to feel very good, especially in the first couple weeks. Avoid sleeping on the piercing. Also, don't spin, rotate, or move the jewelry. Leave it alone. Let it heal. Once again, do not play with the piercing. Avoid contact with the piercing. Basically, the more you leave the piercing alone, the faster it's going to heal, the less likely you are to see problems. Isolate. A common thing I hear from people is it still hurts. I don't think it's healed. What does it hurt? Oh, when I touch it and when I move the jewelry. Well, that means that your body's telling you to stop doing that because what you're doing is you're probably prolonging the healing period. Now let's talk a little bit about what the risks are with this particular piercing. Rejection and migration is always a possibility. Not really common, but it is a risk with these. Mainly migration. They will move a little bit just because of the type of tissue it is. Your body kind of puts it where it wants it to be. Stretching or thinning of the outer labia or labia minoras. This is common from the weight of the jewelry, especially common if you use large gauge jewelry or you stretch the piercing. The tissue will kind of thin and pull downward. Gravity is just one of those things that affects human flesh. And if you put extra weight in it, thus they stretch and they thin out. STIs and STDs. Even after this piercing is completely healed, you are more acceptable to both. When you switch partners, practice safe sex the way you're supposed to. Is mainly what we're getting at. Just be safe. You're at a slightly higher risk than you would if you didn't have the piercings. And the last risk, closure. If you take the jewelry out and leave it out for an extended period of time, your body's always going to begin to close the piercing. And you won't be able to get the jewelry back in. Now let's talk about a popular subject, sex. Gentle at first. If it hurts to do something, you need to stop, rest, possibly try doing something else. It kind of gives you some time to kind of experiment, try some other stuff. If one thing hurts, something else probably won't. As I mentioned earlier, latex barrier for a minimum of 6 months. If you're using any type of lubricant, it needs to be water-based, no additives, no flavoring, no scents, none of that stuff, none of that exciting oils, just simple. Latex barriers, if your partner is using a condom, stay away from anything that has spermicide on it. Toys are a pretty common question. I generally suggest, just to be on the safe side, even if you clean yours on a regular basis, just put a latex barrier on it. Just to be on the safe side. They're cheap. Condoms are cheap. It's just safer. The other thing is make sure you're washing them and cleaning and disinfecting them on a regular basis. Do not share them with other people. If you do share them with other people, you definitely, regardless of how well you disinfect that thing, need to use a condom each time either of you use it. Now let's talk about anatomy, placement, etc. With this particular piercing, it's very rare that I've had somebody where they've came in to get it done, and I went, no, this is just not a good piercing for you. The only thing that really changes is how far the angle is into the vulva opposed to just kind of flat on the surface. When we place these, we generally try to place these as high as possible. to avoid interrupting walking and also penetration. If you do it right there, it's going to cause some problems. It's going to be annoying. The other thing we do is we offset them. We never, if you get it done, you're one of the symmetrical people, and you're like, it's not symmetrical, I'm so disappointed. We did it on purpose because we don't want that jewelry constantly banging against each other when you're walking and doing other things, because it's going to damage the jewelry, possibly scratch it. Then when the jewelry spins or turns in that piercing, damage the piercing, and then you're in this whole process of healing again. So they're offset on purpose. With this one, I prefer to do them with one of three types of jewelry, either Katy bead, circular barbell, or curved barbell. I've had good success with all three of those. If it is a barbell type piece of jewelry, it needs to be internally threaded. I don't suggest piercing these with jewelry that is thinner than 12 gauge. 12 gauge seems to work best here because it's such soft tissue. It's going to be less likely to get torn or snagged. Now let's talk about pain in the piercing experience itself. Most of my clients have said on average this is between a 2 and a 6. Everybody has different levels. However, with genital piercings, it's generally kind of this, oh, God, that hurts, and then it's over very rapidly. You don't have that throbbing and aching like you do with other piercings, like even an upper ear helix, where it throbs for 10, 15 minutes in some cases afterwards. With genital piercings, it's like, oh, that hurts, and then it's over. Always, a breathing exercise will help with this. The good old-fashioned smell the cake, blow out the candles. In through your nose, out through your mouth. Usually helps to kind of meditate you and get you in a calm state. And makes this experience of getting pierced a little bit easier. I've seen this done both freehand and with forceps. Personally, I like to do them with forceps. Basically, first off, disinfect the area. Mark the piercings. I will generally, if I'm on the fence, especially if I'm doing a set, because some people will get like 3 or 4 of these done at a time, I'll usually have the person stand up and then raise one leg so we can make sure that there is enough clearance that it's not going to affect how they walk. Then we put you in a reclined position. Clamp it with those Pennington forceps, inject the needle in and through, take the forceps off, and insert the jewelry. Depending on the type, we either use a guide pen or we just put it blunt against the back and then cause some drag, put the jewelry in, close it up, stop any bleeding that may occur. Sometimes these can bleed for a few minutes afterwards or off and on for anywhere from 3 to 5 days in some cases. And then send you on your way. Now, it's not uncommon to have a tad bit of tenderness to the touch or a little bit of throbbing and aching, but not a lot. Not like you're going to see with other piercings. One thing I always forget to mention in these is bleeding. In some cases, people will bleed anywhere from 3 to 5 days with genital piercings. I generally suggest wearing a sanitary napkin or pad during that period of time, not only to cut down on the possibility of staining clothing, but also it adds a little extra cushioning. And it cuts down the amount of moisture, which will help with cutting down the amount of bacteria that's in the area. But usually a day, and then they're done. But sometimes a little bit longer. Really, everybody's a little different. What you should consider before getting the piercing done. First one is you can't sleep on it. So you want to prepare for that ahead of time. If you're a stomach sleeper, I would suggest trying to train yourself weeks leading up to it to sleep on your side or your back. I use a sleeping pillow or a body pillow to keep me from turning over. Try a couple different methods to see what works best for you. Some people will swear by putting a pillow between their legs to keep them from tipping over. Just see what works best and kind of start training yourself in advance. The next one is kind of important. Talk to your partner. If you are in a committed relationship or an intimate relationship, this will affect how you interact with your partner for about 6 months or maybe longer. You need to talk to them about it and make sure that they're okay with it. The bottom line is it is your body and your decision, but it's good to have their insight on it and how they feel about it because they're your partner. The other thing is, do not do this as a surprise for a special romantic evening. I don't know how many times over the years I've had people come in, and with Valentine's Day, just, this time of year, it kind of comes to mind. would come in to get pierced to surprise their honey and then find out that it wasn't that much of an enjoyable event. You're dealing with a piercing that is not going to want to be played with. The area is forbidden in a lot of ways. They're not going to be able to interact with that jewelry the way they would like to. It's best to wait till after the romance, then get it done, or get it done far in advance. Like if you have somebody on deployment and they're gone for 6 months, get it pierced right after they leave on deployment, so by the time they get back, it's ready for it, for action, so to speak. Also, it's a good idea beforehand, especially if you talk this out with your partner, to schedule a time to kind of have some intimacy and some playtime to get some of that sexual energy out of you, because you're not going to feel up to it physically for a while, though these tend to remind you over and over again that you are a sexual person. Loose-fitting clothing is best, things like sweats, pajama bottoms, something comfortable for the first couple days. If you can, take a couple days off from work and just relax around the house, or do this on a 3-day weekend, beginning of 3-day weekend, so that you don't really have to do a lot of walking or movement and just relax and give your body a little bit of time to recoup and get into that healing phase. You are not going to be able to swim, as I mentioned already, so if that's part of your daily life or what have you, or you're involved in, I don't know, swimming professionally, or you're an athlete, in some way, shape, or form that involves swimming, you want to do this when you have at least 3 months of downtime where you're not going to be in the water. Same thing goes for, anything, any piercing. You need to kind of plan ahead. It's best to do it in the off season than try to deal with it. There's no magic thing you can put over it that's going to not be a problem. And the only thing that would really work would be waterproof bandages. And let me tell you, putting them on and taking them off and putting them on and taking them off would be a total hassle, especially if you're doing it on a daily basis. And just one more thing you have to deal with while you're trying to train. So wait or do it far in advance. Off season. Lastly, are you going on vacation or some type of business trip and going to be out of your normal environment? The thing with travel is oftentimes we're in environments that we've never been in before. We may not have been exposed to some of the pathogens in that environment and have not built up the immunity. So that puts us at a slightly higher risk to infection. You add to that the fact that you have no control over how clean your environment is, and it kind of increases that risk to infection. The other thing is most people are a little bit more stressed, and it's kind of a hassle to deal with constantly cleaning a piercing while you're on vacation. So I really advise getting it done far in advance to the point where it's healed by the time you go on vacation or after you come back. The other thing is swimming, as I already mentioned 3 times now. Can't do it. And you're going to want to swim probably if you're on vacation, depending on where you go. Do you have labia majora piercings? What are your experience with it? Or maybe you had a partner that did. Please leave a comment. Till next time, here's hoping all your piercings heal with ease without a single issue. And if you are in the Des Moines, Iowa area, I hope to see you for your body piercing needs in the future. Have a good day, everybody. Take care, and we'll see you in this next video.